Welcome back. If you've been prescribed a medication for a chronic or complex condition and you may be months away from your next visit with the doctor, it's very possible you may need specialty pharmacy services to help navigate your medication. Now, UofL Health Pharmacy Manager Chelsea Mayer joins us to talk about this. Chelsea, thanks so much for being here.
Of course.
First of all, explain to people at home what specialty pharmacy is.
Of course. Specialty pharmacy is a subset of retail pharmacy, so we work very closely with community-type pharmacies to help patients who have unique disease states or have more complex medication needs. So things that you might be injecting at home, or if you're on chemotherapy, or if you've had a transplant, patients like that are mainly who are going to benefit from specialty pharmacy services.
Okay, so if they're having an issue, it's very important they get their medication right away.
Yes.
So who are these folks? Tell us about, what you can do to help these folks.
Yep, so we have a full team. We have pharmacists, we have pharmacy care advocates who are pharmacy technicians that are going to help you navigate your insurance process and financial assistance or potentially getting like grant funding for your medication. And then we also have pharmacy technicians that are dedicated to our patients to call them for refill reminders, set up shipments, help you if you have a medication that you need to take with food and you don't have access to food right then. Anything like that, we can come through and help you. We've got on-call 24/7.
Okay. Is a big part of the problem, there are people that have to take a pill every day, right?
Absolutely.
And if they don't get it from, a lot of times your pharmacy's like, oh, I haven't heard from the doctor's office yet. That's with a lot of folks.
Yep.
So when you've got to have these medications that are life-changing, that could be a real problem. So how do you come in and work to deal with, insurance and all that?
Yeah. So that is probably the most important part of a specialty pharmacy is helping overcome those barriers to your treatment. I always say the most important thing about picking a medication is the one that the patient can and will actually take. Okay. So in specialty pharmacy, we're dedicated to working with your provider. We'll call your doctor's office and ask if we can help with the prior authorization through insurance. We will work through manufacturer programs, online copay cards, grant funding, even some local organizations that are willing to donate and help with that if that's possible. We'll work through those more unique scenarios to make sure that you have your medication, because a lot of times by the time you need a specialty medication, it is your last option, and we need to make sure that happens. Particularly if you're already a patient of UofL Health, we have access to your health records within your within the health system. So we have a connection to your doctor's office. We can message back and forth in your chart. We can even message you in your chart and cut out some of that extra telephone time and back and forth and get you your med faster.
Does it cost patients anything?
Nope. We just want to service you through your medication.
Okay, and then you wanted to mention really quick in harm reduction services.
Yes.
Mainly about vaccines, right?
Yes, absolutely. So it's that time of year. It's time for your flu shot, for another COVID vaccine. So at UofL Health, we've got locations at UofL, Mary and Elizabeth, Peace Hospital, and Jewish Hospital that we can administer your vaccines all year long, but we particularly ramp up services around this time. And then we also want to let the community know that regardless of what medications you're receiving or what life circumstances you have, we're able to dispense Narcan to help with rescue overdoses, whether that be you're a good Samaritan in the community or you need it in your life. And we can get that as low as $0, depending on your coverage and some special programs we've got here in Kentucky.
Wow, very important information. Thanks so much for bringing it to us, Chelsea.